My name is Lindsay McGee, and I am the Waiver Manager at the Bureau of Developmental Services, BDS. These recorded training sessions are intended to provide information on each service available on the Developmental Disabilities, DD waiver, Acquired Brain Disorder, ABD waiver, and the In-Home Supports, IHS waiver. In this session, we will be discussing in-home residential habilitation. We will describe the service, talk about a scenario, and then provide any additional information that may be important to know about the service. The information in this presentation is applicable to the in-home supports waiver. How does the in-home supports waiver define in-home residential habilitation? The waiver defines in-home residential habilitation as supports that assist individuals with the acquisition, retention, or improvement in skills related to living in the community. These supports include adaptive skill development, assistance with activities of daily living and community inclusion that assist the individual to reside in the most integrated setting appropriate to their needs, personal care, and protective oversight and supervision. But what does this mean, and how does this help me achieve my goals? In-home residential habilitation means providing personalized help to individuals so they can learn, keep, or improve skills needed for living in their community. This help includes teaching everyday skills, assisting with daily activities, and encouraging participation in community life. It also involves assistance with personal care and making sure that the individual is safe and well supervised. Now we will walk through a fictional scenario to describe in-home residential habilitation. Here's some background. Meet Riley. She is an 8-year-old girl with a developmental disability. Riley lives with her parents and sister in a small town. She has difficulty with communication, social interactions, and performing tasks independently. Riley often feels overwhelmed by changes in her routine and struggles with sensory sensitivities, making it hard for her to participate in typical childhood activities. So how does Riley access and use in-home residential habilitation? Riley's parents discovered in-home residential habilitation through a recommendation from their pediatrician. They contacted a local service provider who conducted an assessment to understand Riley's specific needs. A person-centered service agreement was created, and a trained direct care worker began visiting Riley's home several times a week, including after school and weekend hours. They worked with Riley on developing adaptive skills, such as dressing herself, brushing her teeth, and following a daily schedule. They also helped Riley with communication techniques and social skills, using play-based activities to make learning fun and engaging. Additionally, they supported Riley in participating in community activities like visiting the local park and attending a children's art class. So what was the outcome of this service for Riley and her family? After several months of receiving in-home residential habilitation services, Riley has made noticeable progress. She became more independent in her daily routines and required less assistance from her parents. Riley also improved her communication skills, which has helped her express her needs and feelings more effectively. She started to enjoy social interactions more and made a few friends in her art class. The personalized care and supervision provided by the provider ensured that Riley felt safe and supported while exploring new experiences. Overall, the service has significantly enhanced Riley's quality of life, allowing her to thrive in her home and community. Lastly, we will discuss any service limits and requirements that must be included in the individual's service agreement. We will also discuss if this service may be provided remotely or in an acute care setting. When a service can be offered remotely, it means you don't have to be physically present at a specific location to use it. When services can be accessed in acute care, it means that individuals who are in a hospital or another urgent care type facility can still receive these important services. When waiver services have limits, it means there are specific restrictions or caps on the type, amount, or cost of services that can be provided. For in-home residential habilitation specifically, there are no service limits regarding the amount or cost of the service. However, it is important to remember that the in-home supports waiver does have an overall cap at this time of $37,450. So that cap may not be exceeded. This service can be provided remotely, and it also can be provided in an acute care setting. For requirements in the service agreement needs to identify the desired goals and outcomes for the individual over the coming year while they are accessing this service. Thank you. If you have any additional questions on in-home residential habilitation, please email bds@dhhs.nh.gov.